Chair, and thank you for the witnesses for coming out here today. Dr. Nick, did the Federal Immigration Department consult with the Medical Council of Canada on this year's Federal Immigration Levels Plan?
No, not.
Did the Federal Immigration Department ask for any data on the current capacity of Canada's healthcare system on this year's Immigration Levels Plan?
No, they did not.
Well, my next questions are for the Society for Canadians Studying Abroad, Medicine Abroad. So is the Federal Immigration Department approving permits that allow foreign doctors to train in Canada through the visa trainee program?
Sorry, I couldn't hear your question.
Is the Federal Immigration Department approving permits that allow foreign doctors to train in Canada through the visa trainee program?
Yes, without the LMIA process. So no analysis is the impact on Canadians. They are allowing it despite our objections, despite our application. They are ignoring our application to insist on finding out what the impact on Canadians is.
Once these visa trainees complete their medical training in Canada, do they stay to practice here, or are they required to return to their home countries to practice?
Under their contracts with their sponsor, they're required to return to their home country. And most of them do. Some of them ignore their contract and stay.
The federal government approving work permits for foreign doctors to train in Canada under the visa trainee program, only to send them home afterward, while thousands of qualified Canadians studying medicine abroad can't secure a training spot here?
Do you want to take that?
Well, you both can answer. So.
Yeah, that's a darn good question. Very good question, why they're doing that. We know that this came about by the request of the Faculties of Medicine of Ontario, supported by the others. What's happening is that the faculties earn $100,000 of as an application. That's what they charge each year of these foreign physicians, so it's a very good source of income. Millions of dollars are earned every year by the faculty. They can use that money at their discretion, and so what they're doing is using, taxpayers' resources and our trained doctors to train these foreigners so that they can then have a lot of extra money for the purposes that they want, whether it's research or whatever. I'm not against them making money. What I'm against, what we're struggling with, is that Canadians are literally dying. They're not able to get back to work. They're losing their homes because they can't get their problems. And as a result of that, that should be far more important than the faculty being able to make a little bit extra money, so that literally thousands, as Varen said, there were 1,000 this year of qualified people ready to go to work, and as resident physicians, and that was not able. A few years ago, the Ministry of Defense wanted to fund 50 residents, and the faculties said no, and they gave them 5. They said we have the capacity to do 5. The next year they did 8.
Nicely to my next question here. Thank you for that explanation. Are foreign-funded visa trainees using medical training capacity that could otherwise be available for Canadians who study medicine abroad?
Absolutely, and the numbers are great.
Dr. Monkley, did you want to add anything to this?
Yeah, the teaching hospitals rely on residents. They're a source of good labor, and they provide a lot of the care in hospitals. I certainly believe there's capacity to train more.
How many Canadians are currently studying medicine abroad and are unable to obtain residency position in Canada after graduation?
There are 3,500 that are studying abroad. About 800 graduate every year. This last year, there were 181 off the top of my head that applied, but that actually is in response to more residency positions. In 2022, there were only 119 Canadians out of 800 that applied after graduation because of the barriers. The chances are so slim. It's in Australia, you're almost guaranteed.
Country is benefiting the most from the visa trainee program?
United States of America. Sorry, which countries from the visa trainees?
Visa trainees, yes, sorry. I've switched back to visa trainees.
Oh, sorry.
Which country
Saudi
is benefiting?
Arabia, there's
30
currently
seconds.
1,117 Saudi Arabians training in Canada at this time.
Okay. Before the federal government brings in more foreign doctors through immigration, should it first make sure that qualified Canadians who study medicine abroad can return home here to practice?
9 seconds?
Yes.
To answer?
My question is for Dr. Alexander. Thank you all for coming today. Dr. Alexander, thank you for your heartfelt story. It sounds like it's been a difficult road, especially since any Canadian who's listening to this knows that we need family medicine and psychologists throughout the country. And we're desperate for them, in fact. So my question for you is, after you completed your medical education in Australia and decided to return to Canada, you knew you wouldn't be able to practice, or did you know that you wouldn't be able to practice is actually my first question.
Right away, no. I believe that I would still keep applying for residency positions. I took other work in the interim to try to sustain my family for the time while still trying for residency. But it was when the examination requirements changed on me that I was no longer eligible, and that's when I had to permanently shift.
Dr. Alexander, so you were given false expectations about your ability to practice in Canada after you arrived here, and I'm sure you're not the only one who has practiced, a Canadian who has practiced abroad who's given also those false expectations.
Yeah, to a certain extent, after the 2 years of applying for residency with no success, it did feel like the rug was kind of pulled out from under me, because now new requirements were required for me to even have the privilege of applying for a residency in Canada.
Was there an offer you received to stay and work in Australia in their healthcare system?
Absolutely. And I had to make a personal choice. I had an internship lined up in a rural hospital in Australia, and I made the active commitment to come home so that my wife and I could have our family closer to our family. And that was the sole decision why we came home.
That's amazing. Thank you for doing that. In your experience at the University of Queensland, how many other Canadians studying abroad do so with the intention of returning to practice in Canada, but end up accepting positions in systems like Australia or the United Kingdom?
Very good question. I would say the majority of Canadians, when we walked into, and I can at least speak for the 60 60 Canadians who were in my cohort, I would say the majority of them had the expectations to come back home after graduating. But I think going through the process of going to school and then understanding the need of the requirements of coming home to Canada, I would say more prepared themselves to go to the U.S. through the STEP programs to try to get residency in the U.S. as opposed to trying to come home to Canada. And then others settled on the fact that the lifestyle in Australia was very equivalent to Canada, and they could happily practice there after graduation. So I would say by second, third year out of 4 of medical school, most of the Canadians had already made up their mind that they were not going to even try to come home.
Thank you. I think you mentioned earlier 58 out of your class of 60 ended up staying in Australia or going to another country. So, and you were actively recruited by the government of Canada or from a medical association to come back?
No, I made that choice on my own to come back and to try to, I guess, luck the system of the residency matching here in Canada. So I knew my chances were quite low. I think what I fully understood was it was about 10% based on the applicants to available positions. So I took the risk, and I had assumed that I would have more time to try for the residencies, more time as in more than 2 years, but that was not afforded to me.
Yeah, I'm guessing that you would have loved to have stayed in Canada and done your studying instead of going abroad. So my question to you is about the visa trainees. This program is where international medical school graduates receive postgraduate opportunities in Canada, but then they study here, take up seats, but they have to leave after they study. I believe there's one of the board mentioned that. One of you mentioned that 1,017 Saudi Arabians were now in those seats.
30 seconds.
Does that concern you that you weren't able to study here and those seats were taken for study?
Absolutely. If the opportunity for a Canadian who funded themselves to go abroad, get the equivalent training, do the equivalent exams, and be able to try to come home and practice in their home country, to find out that there is foreigners who are paying their way to come to Canada, take up a training position. I know it's not necessarily a residency position per se, but takes the same seat from a physician who does the training, to not be able to then have something available to someone like myself. It reminded me back in, I think it was 2018, 2019, when the Saudi Arabian government had issues.
Mr. Alexander, we're over time.
Canadian positions, and there were hospitals in Ontario that were going to shut down because of it. That was really the first time that I heard about the foreign trained visa programs and the risk that it posed to the Canadian healthcare system.
Thank you very much. We've gone 36 seconds over time on that question. Just wanted people to try and be sticking to the time.
Dr. Naik, thank you for coming. For everyone's information, what exams in total does the MCC administer?
The MCC examines 3 examinations. One is the qualifying examination, which is a written examination, multiple choice, issued in countries around the world, issued over 100 days of the year in 4 different sessions. So no barrier to taking that exam. That is an exam that is done usually at the end of medical school prior to supervised practice of residency. We also have an OSCE examination, which is used for the purpose of selection into residency programs. And then we do have a selection exam as well that is used with variable uptake for our practice-ready programs.
Thank you. And then just top line, how do the success rates or the pass rates of Canadian medical school graduates, Canadians studying abroad, and other IMGs differ?
Our Canadian medical graduates are highly successful on our examinations at the end of medical school, but ranging between 80 to 98% on their first attempt, and goes up with second and third attempts. International medical graduates, again, with different curriculum and recognition that we do ask about Canadian-specific competencies like Indigenous health and other cultural competencies, their success rate on the first attempt is usually 50%. Canadians studying abroad are somewhat in between of that. And part of that reflects the fact that they come with some of the Canadian context to their training. And the reality that some Canadians are studying abroad at schools whose purpose is to ready those graduates for return to Canada. And so the curriculum and the exam preparation is geared to that. And so their pass rates tend to reflect closer to that of Canadian medical graduates.
You mentioned that the MCCQE Step 1 is administered internationally.
Correct.
Are you aware, does success on that exam prior to immigrating to Canada affect your chances of immigration? Is the immigration ministry aware of that? Do they take that under account?
It does not impact immigration per se, but it is an examination that we are advising and trying our best to inform candidates that they should do before submitting their application for immigration.
As I recall from my own time writing these exams, they're good exams. They're pretty difficult exams. They are administered in English or French. I would have a really hard time passing those exams if I didn't speak English or French. Do you think that these exams effectively prove language fluency?
Yeah, and we have also worried about language being a confounder, and we do again advise candidates to take their English equivalency or their OET or their other exams before they do these exams for that reason.
And then in my years writing the exams, and then I worked at a couple different medical schools teaching medicine, I don't recall anyone having the old exams for the MCC exams, and this was in contradistinction to the Royal College exams. Is that about your understanding? What accounts for that difference?
I think the difference is that with respect to our examinations, we have many practice examinations that are equivalent to the real examination available to candidates. And in that regard, we hope that we create equity in the system by having that available to Canadian grads and to international grads.
I just want to say that I think it does, and I think you do, and thank you for that. I have a couple other questions for Ms. Pauliak. You mentioned about 800 Canadians studying abroad graduate every year from medical school. Only 100 and some apply to come back. Of that 100 and some, what is their success rate at finding a residency here?
It depends on the year. So, for instance, when there were only 119, the success rate was quite good, with only 23, off the top of my head, give or take, not matching. However, the higher the number of that come back, the lower the success rate.
Of the 700 or so who don't apply to come back, where do they tend to land?
Most of the people, almost all of the people who study in Australia end up staying in Australia, not because they wanted to, but they feel they have no choice. The next largest group goes to the United States. More than twice as many CSAs end up working in the United States, training in the United States and in Canada.
This is not a question. I just want to say that's totally crazy that we're sending Canadian kids to pay $250,000 to get medical training elsewhere and then leaving them to the depredations of the American healthcare system when they could be serving our country and when that's where they want to serve. A couple of times you mentioned that I guess there's a difference between residency seats and residency capacity. So if these visa trainees are using an OR as an anesthesia trainee and they have a preceptor, then they're taking capacity even if they bring their own funding. You mentioned a couple times private funding for Canadians studying abroad. What are the sources of this private funding?
1 second.
Municipalities, corporations, community groups, ethnic groups, foundations, nonprofit foundations.
You?